Autism spectrum disorder, ASD, is a developmental disability caused by differences in the brain. People with ASD often have problems with social communication and interaction, and restricted or repetitive behaviors or interests. People with ASD may also have different ways of learning, moving, or paying attention. Examples of social communication and social interaction characteristics related to ASD can include: avoids or does not keep eye contact, does not respond to name by 9 months of age, does not show facial expressions like happy, sad, angry, and surprised by 9 months of age, does not play simple interactive games like pat a cake by 12 months of age, uses few or no gestures by 12 months of age, for example, does not wave goodbye, does not share interests with others by 15 months of age, for example, shows you an object that they like, does not share interests with others by 15 months of age, for example, shows you an object that they like, does not notice when others are hurt or upset by 24 months of age, does not pretend to be something else, like a teacher or superhero, during play by 48 months of age. You can help your child be the best version of themselves and to live a great life by supporting their unique identity, their personal strengths, and implementing effective strategies to improve their skills and development. You can use the concept of positive reinforcement to help your child thrive in their day-to-day life. This strategy can help your child demonstrate appropriate behaviors in their interactions with others as well as in the way they handle daily living activities, such as self-care and daily routines. Positive reinforcement is not just giving rewards like offering stickers or candy after your child does something you want them to do. Positive reinforcement, from the behavioral science perspective, refers to the concept of how a person will demonstrate a specific behavior more often as time goes on, based on the occurrence of a specific event or experience happening right after that behavior. To use positive reinforcement to help your child get out of bed on time or at least not linger in bed for too long, you could set the expectation that you want your child to get out of bed within 10 minutes of you telling them to get up in the morning. The skill of getting out of bed on time is essential for kids and adults alike. By helping your child develop and strengthen skills that will help them in their childhood and even in their future adult lives, you are setting up your child for success in life. By using positive reinforcement to help improve skills in your child that are important to their well-being, from self-care tasks to increasing independence and much more, you are helping your child to thrive. Just like adults, every child is unique in their own way. This is especially true for children with autism. To support your child's unique self and help your child with autism thrive, there are a few strategies that you can implement. It's important to have good observational skills as a parent of a child with autism. By looking closely at your child's behaviors and their reactions to their surroundings, both the physical environment and the people around them, noticing their emotional states, and being aware of their thoughts and preferences, you can learn more about your child. Throughout the process of noticing your child, of being observant, as well as through assessment of your child's functioning and development, you will learn more about your child's interests. Even if you already have an idea of what your child likes, it can be helpful to look a bit more closely. Think about what your child prefers in regard to their 5 senses. Hearing: do they like certain sounds? Do they get overwhelmed when there is too much noise or when they are in public places for too long? Sight: does your child like to look at certain stimuli, such as lights or tractors or dogs? Touch: does your child have certain preferences for specific types of textures? Do they like to feel or touch things? Do they not like the feeling of certain things? Smell: does your child enjoy certain smells? Do they get disgusted by other smells? Even simple things like the smell of freshly baked bread or not liking the smell of certain soaps can be important to note about your child. Taste: does your child really like certain foods? Do they not like certain foods? Supporting your child's interests and preferences may be a bit tricky at times. Although it is important and recommended to allow your child to have more preferred experiences and to try to keep their unpreferred experiences to a minimum, sometimes it may be appropriate to gently challenge your child to overcome their discomfort or at least to tolerate their discomfort from time to time. It's common for many parents of children with autism to be told repeatedly about all the things their child might not be doing quite right, or what their child is not good at, or what skills their child is behind in. One of the most highly recommended parenting strategies for how parents can help their child with autism thrive is to incorporate antecedent strategies into the child's day. Antecedent strategies are things that you, as the parent, put in place before your child engages in a specific behavior. The purpose of antecedent strategies is to get your child to be more likely to engage in the desired or appropriate behavior and to reduce the chances of them engaging in undesirable or inappropriate behaviors. Most people get frustrated or stressed when they are asked to do things that seem too difficult. This is especially true for kids. You can help your child thrive and live a better life by reducing the response effort required to complete tasks that you want them to do. Instead of asking a child who has an extremely messy bedroom to clean their entire room, you could ask them to make their bed. Then, later, you could ask them to pick up dirty clothes. Later, you can ask them to do another task, and so on. Instead of asking a child to do an entire math worksheet, ask them to do one problem. You can build up to having your child do an entire worksheet in one sitting. We have discussed many different parenting strategies that you can use with your child with autism to help them live their best life. Let's recap what we've covered. You can use the strategy of positive reinforcement to encourage your child to engage in behaviors that will help improve their quality of life. You can support your child's unique self by being observant, supporting your child's interests and preferences, and working with your child's strengths. You can also incorporate antecedent strategies into your family's daily life to help support your child's positive behaviors and reduce maladaptive behaviors, which will ultimately help them develop and thrive throughout childhood and even into their adult years.